Hi, Assalamualaikum. With me again, Teacher Aisha. So today I'm going to present about the flat food. So what I'm going to discuss about the flat food today, they have introduction definitions, etiology and pathophysiology, symptom, causes and risk factor, diagnosis, and also I will conclude with the treatment. Simple treatment for who under the flat food. So in introduction, they are going to explain about what is the flat foot and also what is the pest blindness, which is the other's name for flat foot. Okay, what is flat foot? Flat foot is a condition in which the longitudinal arch of the foot is lost. It also involves abductions of the forefoot and valgus deformities of the hind foot. Inflexible flat foot, the arch is present during non-weight bearing but is lost during weight bearing. In rigid flat foot, the arch is absent in weight-bearing and non-weight-bearing position. Okay, flexible flat foot is common in young children and may or may not resolve without treatment. Adult acquired flat foot is also common. However, the exact incident is unknown because it is often misdiagnosed. This is the order may be congenital and acquired. Okay, next is pest planet. Okay, pest planet is others name for flat foot. Okay, the pest planet describe a foot that exhibit longitudinal arch and an angle that is inverted, which is valgus. Okay, valgus is the position which is the leg is inward tau. So inward is because of the flat foot punya curvature, curve dia no curve in a arch. Okay, it can be classified as a rigid or flexible. A rigid flat foot is often associated with a tarsal coalitions or a vertical talus, and a flexible flat foot is considered a normal variant. Breast planus is normal in children up to 6 to 7 years old of age. A rigid flat foot is always flat, but a flexible flat foot appears normal when non-weight bearing but becomes flat when steady. If a flexible flat foot is asymptomatic, no treatment is warranted. But if it is symptomatic, then arch supports are often incorporated. If the deformity is rigid, then the underlying causes, example, tarsal correlations, vertical talus must be addressed. Okay, so in other slide, I'm going to talk about the tarsal correlation as a vertical talus lah. Okay, now definitions for the flat foot. Flat foot or the flat feet is a common condition, also known as a flat foot ataupun pes study, in which the arch on the inside of the the feet flatten when pressure is put on them. When people with the flat feet stand up, the feet points upward and the entire soles of the feet fall and touch the floor. Flat can occur when the arch don't develop during childhood. It can also develop later in life after an injury or from the simple wear and tear stress of age. Okay, this is a pictures differences between the normal arch and the flat foot. Okay, so in a normal arch ataupun the normal foot or normal arch lah, they have a curvatures which is not in in between of the high arch ataupun flat foot. Okay, this the other picture shown the flat foot. Okay, for the etiology and pathophysiology is will describe about the how the developments happen during how the flat foot will develop. Okay, in a pathophysiology ataupun etiology, which is the causes, kita kena tahu the causes, which is either congenital ataupun it become because of the posture or the weakness. Okay, in this etiology ataupun this pathology, it is because of the weakness of the tendon ataupun we call the laxity of the ligaments. Okay. So the flexible flat foot is come when children ataupun the childhood punya period, which is dorang is very uh, invisible, which is in a certain position dorang akan ada develop of the arch. For example, they going to have arch during the sitting, during squatting, during walking and also crawling. But in during standing, they may become the flat lah. So that was cause this is the flexible flat foot means. Okay, so the flat so now we're going to talk the pathophysiology based on the flexible flat foot. It's caused by the laxity of the ligaments. Okay, the ligaments that we're going to mention is posterior tibial tendon. As in the pictures, the posterior tibial tendon is attachment for the fascia, which is the fascia, which is the lapisan yang attach with the ataupun yang membentukkan arch kita. Okay, arch of the foot. So, adult acquired the flat foot or fallen arch is commonly believed to be caused by the posterior tibial tendon insufficiency. So what causes of this insufficiency? So this is because of the obesity, neuropathy, soft tissue trauma, and the bone trauma are possible cause of the tibial tendon insufficiency. So the rigid flat foot is caused by the bone abnormalities such as tarsal coalitions, congenial vertical talus or arthritis. So in introduction, kita ada cakap pasal the tarsal coalition, congenial vertical talus. So these two condition is come from the from babies ataupun the childhood ataupun mempengaruhi the developments of their period. So the next kita talk about the causes. One is obesity. Obesity when our body will be big. They are going to put all the pressure over the arch. So become more pressure, bila kita bagi tekanan on this arch, so the arch will become flattened. Okay, next is neuropathy. Neuropathy is some yang unable to control some to control the structure of something, which is in this focus of the structure of the tendon ataupun ligaments tu lah. So when people who got the neuropathy, so they cannot cannot hold the structure of the ligaments ataupun kita panggil dia become weak. Okay, next is soft tissue trauma. So soft tissue trauma can be attack the fascia ataupun the ligaments itself. So the bone trauma is more pada the bone attached to the ligaments too. Okay, so next slide going to talk about the causes from the congenital. Okay, for the arthritis jadi because arthritis, as we know that the joints become inflamed. So di sini bila joint become inflamed, there might be the deterioration to the ligaments, which is ligament yang terlibat posterior tibial ligament. Okay, this is some pictures. They are described about the tarsal coalitions and also the congenial vertical talus. Okay, the first picture here, there is a tarsal coalition. Tarsal coalition is bones become bigger ataupun they are going to fuse with two bones. Okay, yang menyebabkan arch dia menjadi flatten as a normal here. So normal ni bila pendek dia punya tulang, and then the arch become tightened. So bila long, dia akan jadi flatter, which is the punya attachments of the fascia tu akan jadi panjang and it become lengthened. Okay, next one is congenial vertical talus, which is this is the very obviously from congenital punya problem. As we see here, kita tengok dekat gambar babies ni, dia punya kaki is flattened because from the giving birth period. Okay, so this is some of the picture that describe about the two condition from the childhood, because of the orang punya development terganggu. Okay, this slide going to talk about the symptom, causes, risk factor, and factors. Okay, most of the symptom have no symptom associated with the flat feet, but some people with the flat feet experience foot pain, particularly in the heel or the arch area. Pain may worsen with activity, swelling may occur along the inside of the ankle. Okay, this is because tadi kita ada mention about the arthritis. So, okay, this arthritis yang akan menyebabkan kaki kita sakit, kaki yang get the flat feet, because they have the weakness of the tendon and the ligaments, because they have the cancer because of the age, because of the faktor usia, lepas tu because of the weight. So this is akan develop the arthritis and also can cause the pain. Okay, kita tahu the causes is unknown, but the causes can be triggered by the obesity, by the neuropathy, by the structure, frequency of kita punya activity, daily living, and also the obesity. Okay, so children are also they can be causes by the flexible flat foot lah. So bila the flat foot, they can macam they diagnose from childhood yang dia ada flat foot, sebab kita tak nampak from that. Okay, the risk factor tadi dia akan jadi tendon rupture and also arthritis. Faktor obesity, injury to the foot or the ankle, rheumatoid arthritis, aging, and diabetes. Okay, for the diagnosis, to view the missions of the feet, a healthcare provider with observe feet from the front and back and ask to stand on toes. The provider will test strength in the ankles and locate the main area of pain. The wear patterns of shoes also may reveal information about feet. Okay. Okay, next test. Okay, test untuk tengok flat feet, dia akan jadi tengok by X-ray, CT scan, ultrasound and MRI. So the result akan tengok the conditions of the structure of the bones, condition of the tendons, condition of the ligament tadi, posterior tibial ligament from MRI ataupun ultrasound. Okay, from the CT scan kita boleh tengok directly what is the rupture yang become the hip flatten ataupun it came from congenital tu. Okay. So the best, sebenarnya flat feet is there's no cure. Bukan the treatment. Okay, the treatment is unnecessary because they have not harm. Okay, so once it become pain, they are going to do in therapies, which is do the physiotherapies, ataupun wearing shoes, the right shoes to give the arch back ataupun the support the arch tu lah. So mostly what they do in physiotherapy, they are going to do a bit ultrasound, we doing tests, will do if they have arthritis, mereka akan do the ice pack lah, so ice treatment ataupun cryotherapy. So if they become severe, they are going to give the medication, which is the painkiller. Okay, so because surgery is very unnecessary, this is the last choice for surgery. So surgery sebenarnya tidak perlu, but boleh bila bila dia severe, yang tak boleh dirawat dengan physiotherapist, put shoes wear, and also medication. Alright, that's all from me. Thank you.